Hello everyone. I'm going to speak about some sensitive medical topic today for which introducing myself becomes very necessary. I am Dr. Shaini Linu. I'm an Ayurvedic doctor, diet and nutritionist with 16 years of experience. Actually, I wanted to start my official YouTube channel from next year, but something insisted me to do this video today and I could not stop myself. It is heartbreaking to see many young people die of cardiac arrest. Many celebrities have died recently because of cardiac arrest, and one such sad incident happened in our church, which was really heartbreaking. I believe it is high time for people to understand the potential of Ayurveda, understand what can be done in such situations and how such situations can be avoided. For the people who still ask me, does Ayurveda really works? Ayurveda is a science. Many scientific studies have been conducted in India and abroad, and people around the world are accepting Ayurveda, adopting Ayurveda, and Indians, being Ayurveda the Indian science, they still doubt the potential of medicinal plants and they rely on conventional medicine for anything and everything. Conventional medicine, of course, it is very good to manage emergencies, but Ayurveda is about prevention and cure. Great importance is given for prevention of the diseases. God has created so many plants around us with various medicinal properties. Instead of doubting its potential, try to make use of it. Cardiovascular diseases are one of the major cause of death worldwide, and it will become even more prevalent because of the lifestyle changes, diet changes, and because of environmental pollution. Sudden cardiac arrest and myocardial infarction or the heart attack are both two different things. Sudden cardiac arrest is a life-threatening condition where the heart comes to a standstill and the heart stops pumping the blood. Normally, when the heart pumps the blood reaches different organs and the oxygen reaches different organs through the blood, and the functions of the organs are carried away normally and they stay alive. But here, in conditions of cardiac arrest, the heart stops pumping the blood and the oxygen stops reaching different organs of the body. This puts the whole body at risk and the whole organs are at risk. It can turn fatal in just minutes. Sudden cardiac arrest is responsible for almost half of the deaths that cause because of heart diseases, and it is most commonly seen in adults in their 30s and 40s. And the risk factors include coronary artery disease, family history of heart diseases, high blood pressure, diabetes, obesity, high cholesterol levels, consumption of alcohol, smoking, and if there is any previous history of heart attacks. And it is mostly seen in men than in women. Now, how do you identify that something like this is happening? What are the symptoms? Increased heartbeat, chest pain, dizziness, lightheadedness, feeling of upset stomach and throwing up, and if there is shortness of breath and loss of consciousness or fainting. So this is how you can identify that it may be a sudden cardiac arrest. And most of the people who suffer from sudden cardiac arrest do not survive as they do not get help in time. The treatment for the sudden cardiac arrest should begin within minutes. Every minute the treatment is delayed means every minute the brain is without the oxygen. So as a bystander, what you have to do is call for the ambulance immediately or ask somebody to do it and you attend the patient. Check whether the person has breathing and pulse. If there is no breathing and pulse, start with the CPR with compression. CPR is cardiac pulmonary resuscitation. So you have to keep your hands like this in between the chest and do the compression. So when you press, the chest should go at least 1 to 2 inch inside. So you have to give 30 compressions like this and then 2 rescue breaths. Rescue breaths means breathing through the mouth. While breathing through the mouth, you have to keep few things in mind. First, keep the chin of the person like this, extended so that the airways are open. Second thing, you have to keep the nose closed by pinching with the hands, or while breathing you can close the nose by using your cheek, and then cover the mouth completely and breathe in. And while breathing in, check whether the chest is rising up. By this you can make sure that the air is going inside. If the chest is not coming up, then it means that the airway is not open, so you have to keep the chin up like this. So this is how you have to do the CPR. It is like 30 compressions and then 2 rescue breaths, again 30 compressions, 2 rescue breaths. So around 100 to 120 compressions you have to give in 1 minute. You have to continue this till you get some help, like till the ambulance arrives or somebody come up for the help. If a person has pulse, and only if there is an irregular breathing or if the breathing is not proper, then compression is not necessary, only rescue breaths are necessary. So one rescue breath should be given every 5 to 6 seconds. CPR can save a life of a person, as it keeps the oxygen circulating and prevents brain death. Every minute the CPR is delayed means the survival rate reduces 7 to 10% per minute. Every person in your family should be taught how to perform a CPR. Even children should know how to handle such conditions, how to perform a CPR. The contact numbers of ambulance should be saved in the phones, and children should be taught how to make the calls. And it is like hope and pray for the best and be prepared for the worst. So now what Ayurveda can do in such conditions? If the person has chest pain and is conscious, then give a big piece of ginger to chew. It is difficult to chew ginger at this time, but it is a matter of life and death, so the person can chew it. So by doing this, by chewing ginger, it actually produces nitric oxide in the body, which helps in dilating the arteries and helps in improving the blood flow. This is what aspirin also does in the body. Aspirin produces nitric oxide and it dilates the blood vessels to improve the blood circulation. If the patient is unconscious, our aim should be to revive the consciousness of the person so that he can breathe. So, according to Ayurveda, nasal drops, powders or fumigation is indicated. It is explained that Trikatu Churnam. Trikatu means it is a combination of dry ginger powder, black pepper powder and long pepper powder. Even though all the three are not available, black pepper powder is easily available in every house. Just take a pinch of black pepper powder and blow into the nose of the person. It is like our aim is like somehow reviving back the person to life. So actually there are research studies that are conducted on patients who are in coma. After doing Nasyam for 7 to 10 days, the consciousness of the person has been regained back. Now, how to prevent such situations? There is a plant called Arjuna. The scientific name is Terminalia Arjuna. There are many studies conducted on this plant. It has cardioprotective properties, it is rich in antioxidants, and it has anti-inflammatory properties. It reduces the high cholesterol levels, reduces the LDL cholesterol, maintains the blood pressure levels, and it is very good to maintain the health of the arteries and the muscles of the heart. It has amino acids like tryptophan, histidine, cysteine, which helps in maintaining the health of the heart, and tryptophan help in maintaining the balance of the nitric oxide. So how you need to take this is, just take 1/4 glass of milk, 1 glass of water. To this add 3 to 4 grams of Arjuna bark powder and boil it on low flame. Boil it till it reduces to 1/4. Then you can filter it and have it 30 minutes or 45 minutes after your breakfast. And another thing is the ginger tea that you can have at night before you go to sleep. For this you need a 1/2 inch of ginger, crush it, and 1 clove of garlic, you crush it and keep it aside for 10 minutes. Why, that I will explain in some other video. Then you add half a teaspoon of turmeric powder to this and boil it on low flame. Boil it, and then once it is boiled, you can switch off the stove and keep it closed for around 2 to 3 minutes. Then you can filter it and drink this. So if you don't like the taste of garlic, you can also replace it with cinnamon and cloves. But yes, garlic is very effective, try to have it. But in case if you don't like, you can have cloves or cinnamon instead of it. So make it a habit of drinking this tea before you go to sleep, and Arjuna tea before like after your breakfast. So have this at least 3 to 4 times a week. This will help in preventing the heart issues, and it will help in improving the heart health. Both ginger tea and the Arjuna tea helps in producing nitric oxide inside the body. This helps in maintaining the thickness of the blood. It doesn't make the blood thin. It will maintain the thickness of the blood, and it helps in removing the plaque formation inside the arteries. I tried to give maximum information possible in a simple way. It's already 11:15 p.m. I wanted to make this video today so that many people get benefit out of it. So I hope I have created some awareness. Please try to share this video and share the knowledge among people. Thank you.